Today is the fifth and final workshop in the second round of technical workshops that we're doing under the Nurturing Neighborhoods Challenge. And our focus today will be on scaling up, how we can scale up young children-centric development through behavioral change. This is a topic that we have touched on in all of our past sessions, and today we'll have a chance to get into it in some more detail. We're very happy to have with us some behavioral science experts here from the Bernard Banlia Foundation and the Johns Hopkins Center for Communication Programs. I will introduce them in a little bit, but they will be conducting the session and guiding everyone on how to really define behavior change objectives as part of your pilot projects. And I hope that this session will help you also in terms of going through the process of doing this so that you can include the output of that exercise in your final proposals too. So without delaying further, I'll just briefly share the overall agenda for today. Just one second. Hopefully everybody can see my screen. Mayank, is this visible?
No, I can't see anything right now.
Okay.
Can you represent, like close and again share?
Sure. Just one second. Yeah, is this visible now?
So I can just see the white screen. If there is any yeah, now I can see. It was visible.
Okay, all right. Apologies, everyone, having some technical difficulties. But what I wanted to just show was an overview of the agenda for today. Maybe I'll just talk through it instead. We're first. We'll hear from Ms. Pooja Sharma, the Undersecretary for Smart Cities Mission, who will share some opening remarks with the cities. Thank you, ma'am, for being with us again here today. And then we'll move into the presentation, which will be for the first half hour of the session before moving into the group out, the breakout exercise, where you'll get a chance to practice in defining these behavior change objectives. And in today's session, we will not come back and report on what we did in each of the groups, but the idea is that we'll come back by about 4:40 p.m. And then take, I'm sorry, not 4:40. We'll start the breakout at 4:40 and we'll come back by about 5:25 p.m. So that we can take 5 minutes to just recap on the way forward for cohort cities before closing the session. So that is the plan for today. So first, I would invite Ms. Pooja Sharma to share some opening remarks with the cities. Are you able to hear me? If you're able, okay.
Thank you, Nandini. Yes, I can hear you, but there is some problem with the video today. In fact, I was having problem connecting my. So, good afternoon, everyone, and I welcome you all for this fifth workshop on capacity building for Nurturing Neighborhood Challenge. Through the updates that we have got to the ministry, we are happy to see that certain cities are taking towards implementation of trials and pilot projects, which includes preparing designs, issuing tenders, securing finance, and necessary approval. Continuing with other vital activities as baseline data collection and stakeholder discussions. So at this point in the challenge, I would request all the participating cities to accelerate the pace of their work with a little over 7 weeks remaining. Different acts can be taken up in parallel as your proposed projects. You will appreciate the unique opportunity to make changes that will improve quality of life for young children and their families. And we hope your teams will seize this moment to implement actions that demonstrate your creativity, commitment, and leadership. We trust that these qualities are evident in you and led to your selection for this challenge will be proven efforts in this challenge. You have all been reflecting on what is needed for long-term transformation of our cities into places that are friendly for young children. Infrastructure changes are an essential part of this entire puzzle. However, it has been repeatedly noted that physical change is not just enough, especially without consulting the communities that are most affected. Consider, for example, you want to provide nursing that need mothers do not. So when you get a baby and you need used by parents, you don't need it for particles, right? So there are such examples that you may be familiar where solutions that look perfect on paper, they somehow did not translate to the desired impact on ground. Further in this regard, as the cities work to contain COVID-19, we have all been familiar with the importance of promoting positive behaviors to ensure that our interventions are sustainable. For instance, how do we encourage people to wear masks? This is a big challenge, right? This is all about behavior. We understand that solving this behavioral issue will help to amplify the impact of our solutions. In the same way, to develop effective interventions in shaping neighborhoods for young children, we need a deeper understanding of the barriers as well as the motivators to you can supplement your pilot intervention strategies to promote positive changes in knowledge, attitudes, and behaviors to young children. Communication and capacity building needs to be done across all stakeholder groups. So today's session will help you to identify behavior change objectives that will be crucial to the long-term success of yours. Finally, on behalf of the Smart Cities mission, I want to thank you all for your participation in this workshop series. Your dedication to improving your knowledge on these topics is noted and appreciated. We wish you all the best in your projects and look forward to seeing the outcomes on ground. So now over to Nandini for taking the workshop forward. Thank you, Nandini.
Thank you. Thank you for joining us, ma'am. With that, I will introduce our expert speakers who are here with us and will be giving this presentation. First, we will hear from Sam Sternin. He's an international development practitioner with over 15 years of experience working at the intersection of behavior change and adaptive management. And he's supporting the Bernard Van Leer Foundation on behavior science work all across the globe. He's worked in maternal and child health and nutrition, early childhood development, and inclusive urban development across sub-Saharan Africa, Asia, and Africa. And then next, we'll also hear from Uttara Bharath Kumar, who has over 27 years of experience in the field of health communications and behavior change. Uttara has been with the Johns Hopkins University Center for Communication Programs since 1997, and she provides regional technical expertise to and support to programs in Asia and Africa. She is currently based in Chennai, but right now joining us from the US, I believe. So it's very early morning for her. Yeah, thank you, Sam and Uttara, and to the Johns Hopkins team, also Sanjita and Anshuman, I believe, are here as well, for being here and for sharing your expertise with the cities. And with that, I'll hand over to you, Sam. If would you like us to start sharing? We have the presentation. I'm not sure if it's the same presentation as Uttara's, but we can start sharing those slides.
That's all right. Thank you so much for that introduction. I'm going to just speak for a couple of minutes, and I have a short presentation that I can share from my end. So that's great. First of all, it's a great pleasure to be here with you today virtually from Vietnam, which is where I am now. I'm really excited about this initiative and the opportunity to have this workshop with all of you. I've been working for quite a while with Bernard Van Leer. and with their partners all around the world. So in Brazil, in the Netherlands, in Turkey, in Peru, in Ivory Coast, really to think about how behavioral science and behavioral methods can increase the impact of the good work that all of their partners are already doing. So I'm just going to spend maybe about 7 or 8 minutes at the start to introduce some content, to share with you the way that we think about this and why we think it's important. And then I'll turn it over to the colleagues at CCP and Uttara. But I think to start off, we decided, and actually the previous speakers was a perfect introduction to this. Thank you so much. Could not have asked for a better introduction and that sort of policy direction. But to start off, we're going to do a little interview. So I think somebody from CCP has some questions. And so what I'm going to do is I'm going to pretend that I am a member of the municipal corporation of a city in India. I'm not going to say which city that is. And we're going to have a quick chat for a couple of minutes before I start my PowerPoint presentation. So perhaps I think it's Uttara or someone if you want to start our interview.
Sorry, Sam, I wasn't prepared for that. I'm going to go just dash to your email with the questions. Give me just one quick second.
Okay, so let me just give
Sangeeta
a little bit of a background while we're preparing for this. So I work in the planning office of the Municipal Corporation of City X in India. And of course, I'm very excited to be part of this Smart Cities Challenge around nurturing neighborhoods. And I've been thinking about and planning my project. I've gone through a couple of rounds already. And now I'm thinking about my final proposal going into the next round. And so that's kind of what I've been thinking about. And these colleagues here from CCP said that they wanted to chat with me and ask me a few questions. So that's to lay the scene a little bit.
So, hi, Sam. Can you tell me a little bit about what your project is about? What are you trying to do? What is your objective?
Yeah, so our project is to create 3 child-friendly parks, public spaces that are really going to be designed for caregivers of children, 0 to 5, so that we have some child-friendly spaces in our city.
Oh, great. Okay, so if you build them, but no one came to use them, do you think you have succeeded?
Oh, no. Of course not. Of course, the point is we want to build these parks, but just like the previous speaker was saying, it's not enough just to build the park. Obviously we want, them to be used. Yeah. So yeah, maybe what I wanted to say was actually my goal is to build 3 child-friendly parks that are going to be used by, that are going to be used. Yep. Mm-hmm.
So what? Oh, that's good. But what if the users are, elderly people going for walks and teenagers playing cricket, etc.?
Oh, well,
is that okay?
I mean, of course, we welcome elderly people and teenagers into the public space. That's great, but our focus is really on infants, toddlers, and caregivers, right? The idea is we really want to have, caregivers and of young children using these green spaces. So yeah, so I think, yeah, that's a helpful question. What I really want is to have 3 green spaces in the city that are going to be used by caregivers and their small, babies and toddlers. Yeah.
So these are, people who are wealthy. What if the people who are wealthy, the upper class people with, ayahs or nannies, they are the ones who bring the children 0 to 5? What is that the sort of group you're looking at?
Not really. I mean, what we're trying to do is create public spaces for people who otherwise, don't have access to them, and people from, vulnerable families, from families that usually don't have, the opportunity. So, we want it to be accessible to everybody, and especially with a focus on, vulnerable families. Yeah. Mm-hmm.
So if about 5% of the low-income population with children under 5 come in and use it, that's good enough, right?
Well, of course, we have limited resources. We can't, cater to everyone, but at least in those areas, in the neighborhoods where we're going to build those parks, hopefully it would be more than just 5%. Like, I hope that at least, most of the families with young caregivers in those neighborhoods hopefully should be using it. Yeah. Yeah.
It's enough if they use it one time? Is that okay?
What do you, one time? No.
Yeah.
We want, the idea isn't that they just come and use it one time. They should be using it. We know that outdoor play and exercise is really important for young children's development, but if they just use it once, it doesn't make a difference. They really need to use it, 2 or 3 times a week at least. So really, I guess what I'm saying is, my objective is that, caregivers, that the majority of caregivers of children 0 to 5 in those neighborhoods where we put the parks are able to use them, at least 3 or 4 times a week, spending time with their kids in those public spaces.
Okay, great. Now I'm much clearer about what you're trying to achieve, and who should use the park. But how will you measure this?
Oh, well, the easiest way to measure it is, we'll just count how many people were there before, and then maybe we'll count how many people are there after we do, after we improve the park. We'll count and see how many people are there. Mm-hmm.
Okay, that's good. But how will you know if that's the majority of people? You aren't counting the people who are not using the park, right?
Oh, that's a really good point. That's right, because I said I wanted most. So, yeah, maybe it's, I can't just count the people who are there. Maybe I might have to do some kind of survey of the neighborhood and ask, some sample of people, are they, sample the parents of children 0 to 5 and ask them whether they use the park, how often they use the park and that kind of thing. Yeah.
Oh, I see. So you just tell people you're from a project that's there to promote play in the parks and ask them if they play in the park, correct?
Well, if I tell them that I'm from the project promoting play in the park and I ask them, do you play in the park? Some of them will say yes, just because they want, they'll feel pressure to say yes. So I'm going to have to do the survey in a way so that, they give me the real information, not that they tell me what I want to hear. Because, sometimes if you say that you're promoting X and then you ask people, do you do X? They will tell you yes, even if that's not the case. So I think I need to think a little bit more about how I'm going to measure my impact here.
Okay, great. Well, thank you for that explanation, and I'm glad you're thinking about how to measure the behavior. Yeah, over to you.
Great. So thanks for sticking with us through that interview. I think what you've just sort of seen and heard is the discussion that we with Bernard van Leer have with a lot of our partners, working on nurturing neighborhoods, working on early childhood development in urban spaces. A lot of our partners, they start by saying, we want to build infrastructure. We want to build parks. We want to build streets. We want to build pedestrian areas or bicycle paths. And by thinking about it, by working through it, what they realize in the end is that the real goal, the real objective is not just to build things, but the real objective is actually to change people's behaviors. And that's why we're talking about behavior change here, right? Because it's not just about infrastructure. Of course, we need to have the infrastructure. It's really important. If we don't have the infrastructure, people can't use it. But I think that if we just have the infrastructure and we don't do all the other things that we need to do to make sure people use it, then we haven't achieved our goal. So our real goal is that caregivers are actually spending time in outdoor spaces with their kids, doing activities that are good for their children's development. So I'm just going to share a really quick presentation, and I'm going to breeze through this because I think we want you to have time to really hear the presentation from our colleagues from CCP, which, you know, but just very briefly, if we look at this photo, hopefully you can see my shared screen. You know, this is an example of a public space. It's a drawing, obviously, but it could be in many different countries. And if you look at it, different people, when I ask them what they see, different people say different things. If I had more time, I'd ask you, we could have a discussion. But some people focus on the infrastructure. You know, there's a nice park, there's like a pedestrian area, there are trees, there's grass. Some people focus, actually, I've had a couple of people focus on the cars and the transportation piece. Some people say, oh, look, there's a health center. Look over there in the back on the right side, there's a health center. But a lot of people say, look at all the behaviors that we see. Look at the different behaviors that we know are important. There's some play, there's some breastfeeding, there's supervised play, there's unsupervised play, there's men and women, fathers and mothers spending time with their kids doing physical play and other kinds of play. So this is really, you know, kind of what we're aiming for. And so when we think about nurturing neighborhoods, and by the way, on some slides you'll see it says Urban 95, which is kind of what Bernard Van Leer calls nurturing neighborhoods projects in other countries. So don't worry about that if you're not familiar with. But when we, you know, think about nurturing neighborhoods, we really want to nurture changes in the behaviors of the residents, right? So we think about the healthy urban environments in blue on the bottom. It's important to have good public space, good transportation options, better neighborhood planning, air quality, exposure to nature. But at the same time, the reason we want those things is so that we can improve caregivers' mental health behaviors, so that people actually use those services, so that we're promoting caregiver and infant outdoor and indoor play, feeding practices, storytelling, singing, etc. So we really need to work on both. You can't do it without the hardware, but if you just have the hardware without thinking about the behaviors, we don't really get to our impact. So where do we recommend people start at Bernard Van Leer? We have a framework that we call 1 + 1 + 1. And so that's, think about at least, you know, a behavior of caregivers in the home, or a behavior of caregivers in public spaces, or, and this one's a little bit different, a behavior of service providers. So why do we encourage people to think about this? Well, the first thing is, why do we care about behaviors in the home? Well, the fact is that most babies and toddlers, infants and toddlers, they spend the vast majority of their lives inside the home, especially during the first 2 to 3 years of life. So as from a public policy perspective, from a social perspective, if we're not influencing what's happening inside the home, and that's where babies spend most of the first 2 years of their life, we're going to miss some really important things. The second area, and I know this is a topic that many of you are working on, so really exciting, is caregiver behaviors in public spaces. So we can create the most beautiful public spaces, but if we don't get caregivers to use them, or if only the rich people use them, so not the caregivers we care about, or other people are using them, or if they only use it for the first 2 months after the launch, and then everyone goes back to normal and no one uses it anymore, that we really haven't succeeded, right? So that's a second area. This last one is kind of an interesting one, but I would guess that most Indian municipal corporations have thousands. Some of the big cities probably have tens of thousands of employees who interact with and impact the lives of infants, toddlers, and caregivers every single day. So that's a huge opportunity. If we have these thousands of municipal employees, if we can improve their behaviors, if we can help them to better serve caregivers, infants, and toddlers, we can have a huge impact. And yes, someone mentioned this, I apologize. When we talk about caregivers, I use that word a lot. Caregivers could be mother or father, but sometimes it's the grandparents, sometimes it may be an auntie, Sometimes it could be, someone else in the family who's taking care of the kids. So yeah, apologies for using that language. So what are some examples of caregiver behaviors that we care about in the home? Well, we can think about feeding practices, indoor play, the things that parents do to manage their own stress at home. Parents or other caregivers, grandparents telling stories, reading, singing, using nonviolent discipline, so not using the physical discipline. These are all different types of behaviors that we think about influencing, right? And, if you think about in public spaces, some of the behaviors could be the same. So first of all, making sure the parents and the aunties and whoever's spending time with the kids are actually using the spaces, using the streets, the sidewalks, the parks that we're developing, and even the mobility solutions. If we're making sidewalks or bicycle paths, we want to make sure they're used. We care a lot about outdoor play and opportunities for that. And the same things around, sometimes maybe the parents just need to go for a walk outside to release some stress, and that's going to make them happier at home, make their child happier as well. Storytelling, singing, and reading, that can happen inside the home, but it can happen outside the home as well. So how can we make sure that our public spaces promote these types of behaviors? And, service provider behaviors, if you think about it, let's start on the right side. All of the doctors, nurses, and social workers, and parent coaches, and teachers, and librarians, they could be providing counseling, mentoring to parents to help them, better raise their kids. They could be referring people to other services if they need help. Think about the public transit workforce, the bus drivers, the ticket collectors, the cleaners, the inspectors, the traffic police. Those people will have a big influence on how parents and toddlers and children feel when they're moving around. Do they feel comfortable using public transportation? Do they feel comfortable crossing the road? Will the policemen help them cross the road if they need some extra time? Do they feel safe? So their behaviors make a huge difference for the mobility choices of parents with young children. And then all the people who take care of the parks, the cleaners, the public sanitation workers, the public safety staff, if we can build a beautiful park, if it's really dirty, parents won't spend time there with their babies, right? Babies crawl around and they put everything in their mouth. So we've got to make sure it's a clean environment for them. So the most important person there may be the cleaner, the sweeper of the park. Their behavior will have an impact on whether or not, caregiver, parents, others are coming out to use that park with their babies. So I'm just going to give you one example, and I'm not going to read through this. But if we thought about a city that decided to promote reading, and this is a lot of our partners in a lot of our cities, they choose reading or storytelling as one of the behaviors they want to promote. And let's say they decided they wanted to promote reading for children 0 to 5 and saying we got to read at least 15 minutes 5 times a week. Because remember, if they just do it once, a positive behavior, if they just read once to their baby, won't make a difference. They really need to read to them on a regular basis. You guys can read faster than me, but this is a list of all the different things that different departments within the city could do to promote reading. So the health department can promote reading. The transportation department can promote reading. The parks department can promote reading. All of these different departments within the municipal corporation can do something to promote reading. And all of these examples that you see on this slide are real world examples from different cities around the world. All of these are things that different cities have done to promote reading. So imagine a city that could do all of these things. I believe that if a city could do all of these things, the number of parents reading to their babies would go up. In fact, I would even say if a city could do half of these things, or even 3 or 4 of these things, they would probably be successful in changing behaviors and getting more parents to read to their kids. So just to close, to kick it off the rest of the workshop, what is it that we want to see from you guys in the next phase of your proposal as you're working on the next phase of your project? So first thing is we'd love to hear from you at least one behavior. What's at least one behavior that you want to change in your city through your project? You could pick one. If you want to pick more than one, great, no problem. But we want to know at least one behavior. Could be in a public space, could be around play, could be around mobility. But we want to see what's at least one behavior that you guys are going to try and influence. Second thing we're going to want to see in your proposal is, how are you going to promote that? So let's say you've built a park. Let's say you've improved the cycle path or the sidewalk, the footpath. What else are you going to do to promote it? What else are you going to do to help people use it more regularly? How are you going to make sure that not just the rich people or certain people use it, but that the families whose kids really don't have opportunities are the ones who really get to take advantage of this? How are you going to promote it? And then the third thing we're going to want to see is, how are you going to measure it? How are you going to know whether you're succeeding or not? What's the indicator? Are you just going to count people, like I said at the beginning in my interview? Are you going to use a survey? Or how would you measure whether or not you're successful in changing behavior, which is a little bit different. You know, it's easy to count how many parks you build or how many kilometers of footpaths. It's a little bit harder to measure how effective you are in changing behaviors. And that's kind of what we want to see. And the great news is that the whole rest of this workshop from our colleagues on CCP is all about helping you start to think through this, work on it, start working on it in some groups and get some of these concepts so that you can incorporate it into your proposals. So I'm going to stop there, but thanks a lot for taking the time to listen to me. And I'm really looking forward to the rest of the workshop and to seeing your proposals soon. All right. Thanks a lot. And so just handing it over now to our CCP colleagues.
Great. Thank you, Sam, for that introduction. I wanted to add just one or two things because I know we're running a little short on time. And I wondered if, Nandini, can we have the presentation on the screen, please?
Yes, Anushree, could you share that?
Great. So next slide, please. I think just taking off from where Sam left off, why do we want to change behavior? Usually to solve a problem. And in our case, if you have a structure, if you have the hardware, how do we get people to use it? How do we get the correct people to use it? How do we get them to use it often? So you have to keep building on all those questions, like you heard in the interview, to make sure we have the right behavioral objective. Next slide, please. It seems as though if we have the behavioral objective, we can just come up with some kind of an approach, right? But see, human beings, people are not that easy. Unfortunately, we are complicated. We don't behave rationally. You know, it's not so easy that you tell someone to do something and right away they do it. Can you think of examples of yourselves when you have behaved irrationally, right? I'll give you an example, myself. I know that exercise is good for me, right? I know that I should be exercising every day. I have all the information on why this is important for me, but I don't exercise every day. Even if there's messages to me about exercising every day, I don't, right? So I'm not behaving rationally. Are there other examples you can think of? You can pop them in the chat box if you have an idea of where you have not behaved rationally. Next, you can see in this picture, actually, sorry, go back to the previous one for a second. He's putting up a sign that says, think safety first. But if you look at what he's doing the exact opposite of what he's asking people to do, right? So this is an example of irrational behavior. How many of us know doctors who smoke, right? Doctors more than anybody should know smoking is bad for them. And yet there is the irrational behavior, correct? So there is a number of different ways where we can say that people may not behave rationally. And there are a number of reasons for this. Next slide, please. Sensory overload. So what happens is we've got so much information coming into our brain that we tend to take shortcuts. We tend to do things that feel good or are easy to do, right? So that we revert to things that seem immediately easy to do. We don't have time to stop and carefully think about every single thing, every decision that we make. So when we're making so many decisions, we quickly revert to what is easy or what is simple, attractive, convenient, etc. So that's sort of the default setting. The rational, thoughtful way of making decisions happens only when maybe it's something extremely important, like you're going for treatment for a very serious illness. Then you're going to do research about lots of different doctors and this and that before you go in, right? So there's two different ways of making decisions, rationally and irrationally. But the point I'm trying to make here is it's not just enough for us to give people information. When you give people information, it's not guaranteed that they're going to actually act on it. Next slide, please. So that's what we were talking about, that making decisions is hard. Next slide. So you see here, this is a classic example. And you can even think about this even with your parks, right? There's a sign here that says, please use the sidewalk or the footpath. And what have people done? You can see, by the way, the marking is on the grass that they have not used the footpath. They have walked through, taken the shortcut, right? Because that is the easier thing to do. So how do we get people to use the footpath, right? So if you think about in a playground setting or in a urban area, it's easier for caregivers to just keep their children at home and play there. It takes extra effort to come bring them to the play area or the park or take them to the Anganwadi, etc. So how do we find out what the barriers are? Why are they not bringing them, even though we tell them, please bring them to the park, right? How can we address those barriers? It's not just enough to make the place attractive. That's one part of it. We also have to address the other reasons why people don't bring the kids to the park, right? It could be that they're busy. It could be that last minute there's lack of motivation. It could be that they don't agree with this outdoor play. They may have other problems or preconceived notions of why it's not healthy for a child to play outside. So we don't know. We have to find out a little bit about what the barriers are to bring the kids to the park. Next slide, please. And there are many white elephant projects. I think our first speaker, Pooja ma'am, has said how there are many, it's not just enough to have a great design because it has to translate to usable solutions on the ground. And a white elephant is something which is very attractive and beautifully built, expensive to maintain, but is not very useful, right? So that's a name given to a project which is not very helpful, even though it's beautiful and costs a lot of resources to develop. Next slide, please. So this is the most important slide I want to share in this presentation, and that there are steps to behavior change and not everyone is always on the same steps, right? So you may be in pre-knowledge, not even know that there is a park or that it's useful or interesting. The next would be that you actually know there is a facility, right? And that you can use it. The next step would be approving of the usage of that facility, saying, yes, it is a good thing to take children to the park to play. It is going to be helpful to my child. That's the approval phase. And thinking about your neighbors and other people with children that age. Are they taking people? Do they approve of this behavior, right? That's the third step. The fourth step is that you actually intend to take your child to the park to play. So that would be one more step there. And the intention, once you have that intention, going from intention to practice can also be a very tough jump, right? So many times we intend to do a lot of things, but we don't actually do it. So lots of parents or caregivers or mothers or grandparents could say, okay, I'm going to take the child to the park tomorrow. But how many of them actually do it, right? So the gap between intention and practice is often very big and is a challenge. So we have to think about our behavioral intervention. How do we address that gap, right? And the last step after practice is advocacy, where you are so excited and like this that you're going to tell other people to do it. And you tell your neighbor or your sister or your somebody, I took the child to the park, I take the child to the park every day, you should do it too, right? That's advocacy. That's the last level. So it's important for us to understand that, people can be on different steps in the steps to behavior change, and it's not everyone who's on the same step. And when we design our interventions, we have to understand where people are and what some of the barriers are that they face to practicing your behavior that you want them to do. Next slide, please. So this is why you need a behavioral objective. In the case of that slide I showed you, it could be something like getting people to walk on the footpath and not the grass. Then, like in the exercise that Sam and I did, who are the people, right? This becomes the next question. So the next slide, please. Who's the audience? Think about who walks in that area. Observe and see which people tend to follow the footpath and which ones take the shortcut. Whose behavior do we need to change, right? It's not everybody who needs the message. It's only the people who are walking on the grass. And why do they walk on the grass? Why do they not walk on the footpath? What are their barriers? Is it knowledge? Is it persuasion? Is it convenience? How do we address that, right? Next slide, please. So we have to understand even when we measure that there are different indicators for measuring behavior and different indicators for measuring the overall program, right? And that behavioral indicators are part of the bigger set of program indicators. Program indicator could measure things like how many parks were built, how many swings sets were set up, or how many murals were painted. So all of those are big program indicators that lead to higher program indicators, which is, has there been a overall change in the early childhood development? But the behavioral indicators specifically measure behavior. Next slide, please. I'll take just a second to talk about this because you'll be working on this in your group. If you oversimplify indicators and think about it this way: effort, effect, quantity, and quality. So how much did we do? This is a monitoring indicator, okay? And then how well did we do it? This is your early evaluation indicator. And then, is there any social or behavioral change? That will be your impact indicator to see the difference, okay? So this is a very simple way of looking at your indicators, and we'll share this with you. Next slide, please. So if you think about my footpath example, the process indicator or the monitoring indicator will ask how many signs were posted in the area about walking only on the footpath, the number of outreach activities conducted in the area about walking on the footpath and not on the grass, the percentage of the area residents who were reached with radio messages about importance of walking on the footpath. This could be your quantity, right? Monitoring indicators. Quality could be things like the percentage of pedestrians who can recall the message that you gave them, the percentage of pedestrians who mention the importance of walking on the footpath. Means that they've not only heard it, but they've also internalized it. And the percentage of pedestrians who say they plan to walk only on the footpath. So that shows you intention to practice, right? So you've got from not practicing or not knowing all the way up to intention to practice. And finally, when you look at the effect, that would be actual practice, right? So when you're looking at percentage of pedestrians who walk on the footpath, percentage of pedestrians who encourage others not to walk on the grass, but to walk on the footpath instead. You're talking about practice and advocacy. So unfortunately, we went through this very quickly, and I hope it's not overwhelming, but you will have a few minutes now in group work to sit down and look at your own behavioral indicators, who the audience will be, and how some of these preliminary indicators might work, okay? And don't worry if you don't have enough time to finish this. I think do as much as you can, and then as a group, you can take this back and work on it some more, and perhaps even share it back with us for feedback. So I will hand it over now to my colleague Sanjita to walk us through the assignment. Thank you.
Hi, everybody. I'll quickly share my screen. Is it visible? Has it? Okay. I guess it is there now. Okay, great. So as you can see, as part of your group work, we apologize, we were supposed to stop at 4:40, but unfortunately, because the concept is such, it needed some explanation. You may not actually have full 45 or 40 minutes to work on your group work, but nonetheless, whatever time we have, I think you can utilize on working on this group assignment worksheet, right? So the first step as part of this assignment is that you need to select a place where you want to work. We've suggested two places. You can choose any one, or you can even come up with any idea that you may have. It could be, for example, the example that Uttara gave about footpaths. So here we have identified one Anganwadi center, and the other one is a park for children, right? The second step as part of the assignment is to define your behavioral objective. What exactly do you want the audience to practice, right? That's what is going to be part of your behavioral objective. And who do you want to practice this behavior? So you're not only defining the desired behavior, you're also defining who the audience is going to be as part of this behavioral objective statement, right? Once you have listed the behavioral objective and the audience, then you are going to list down the key barriers to the desired behavior. And we'd like you to come up with at least 5 behavioral barriers other than the infrastructural barriers. We want you to focus on the behavior of the target audience and not focus on the infrastructural issues that are keeping them away from practicing a certain behavior. It's more got to do with their own personal behavior and not the infrastructural challenges around them, right? The fourth point is this worksheet, which Uttara just talked about, wherein you're going to add the indicators, right? So you have the process indicators wherein you are measuring the quantity of effort, maybe the number of trainings that you have conducted. I'll just scroll down because the next sheet has examples that you can refer to. So for example, in terms of process indicators, it could be, the number of signposts in the area about walking only on the footpath, any outreach activities or any trainings conducted, any information drives carried out, or percentage of area residents reached with a radio message, right? So what were the activities that were conducted to reach out to the audience? And the next is the quality, which is the intermediate indicators, right? So here there are some examples given. Percentage of pedestrians who can recall the message, percentage of pedestrians who mention the importance of walking on the footpath, and percentage of pedestrians who say they plan to walk only on the footpath. So here we can actually see the intent, but maybe it hasn't yet translated into practice. And where are we going to measure practice comes to the effect section, right? So the first two columns we are actually talking about, the first two rows we are talking about the effort that we are going to put in. And the next one is the effect that we are going to get after we have put in those efforts, right? What is the impact? What is the outcome of the activities that you carried out? So two examples given there. Percentage of pedestrians who walk on the footpath. So you actually measure, you actually see that people are walking on the footpath. Next is percentage of pedestrians who encourage others not to walk on the grass. So here comes the advocacy part, that they not just practice on their own, but they are also encouraging others to practice that behavior, right? So this is what you need to do as part of your group assignment. And yeah, you can refer to this particular sheet in case you have any doubts. And each of us are going to be part of your groups, so you can ask us questions or any doubts that you may have. That's it from my side. Thank you.
Thanks, Sanjita, for that. I will. I've already divided everyone into groups, so we'll break out now.
Sure.
Should we start with a round of introduction with everyone? I have a few colleagues from WRI as well. So, Arunima? I think you're on mute, Arunima. I'm unable to hear you actually. Okay, no problem. We'll start with Manoj.
Hi, am I audible?
Yes.
Hi there, this is Manoj. I'm from WR India. I'm currently working in Tamil Nadu.
Okay, great. Anyone else would like to go next?
Hi everyone. Okay, you can.
Hi everyone, this side Prakash Paul. I am basically a senior urban consultant working with BVLF India team.
Great, thank you, Prakash.
Hi everyone, this is Gautam, working in a HMDA from Hyderabad.
Okay, hello Gautam, hi. Next.
Hi, this is Prabhu Patel from Surat Smart City.
Hello sir, how?
Hi.
Hello everyone, Gaurang here from Surat Smart City.
Great, thank you Gaurang.
Yeah, this is Harini from Coimbatore Smart City, and I'm from Tulip team.
Hello Harini.
Hi everyone, this is Gokul Kishore here from Tirupur Smart City.
Great, welcome sir. I think we have one person left, Ankita Jaganwar, if you're there. Okay, she must be having some network issues. Anyways, so welcome everyone to this group 4. And today we'll be doing this exercise what Uttara has mentioned about understanding the behavioral objectives of your city, and also then trying to understand what are the indicators that we should form. So I'll just share a screen right now of this group assignment sheet that we have. Okay, I hope the screen is visible to everyone. So we can start with our group number, that is group 4. And what we can do actually as part of this is we could propose, since we have a mix of a few cities, maybe we can take up one city as a case here, and then we can prepare this entire worksheet for that city, because as we all know, this sheet is something that we'll also be using as part of our proposal, NNC proposal for this stage. So we can either start with Tirupur or Surat, whoever, we can take up one city. If Prabhu sir and Gaurang sir, if you are okay with it, could we start with Surat Smart City? So that way we can take this entire worksheet in reference to the Surat projects. So I'll start with Surat as the case example first. Can we also select a place where you want to work, sir? One of you, if you could just tell us, do you have any place that you're working around, any Anganwadi center or a park? So would you like to pick one? Even other participants can suggest a place to work.
Yeah, we go with Anganwadi.
Okay, sir, sure. So we will pick Anganwadi as a place that we are working for. The next part of this worksheet actually talks about defining your behavioral objective and audience. So we saw what Uttara was talking about, having the set objective of, in terms of the behavior that you want to achieve, that you want to have in this, in the place of Anganwadi, and also the audience that you're targeting. So this audience can be directly the caregivers or the users of the space. It could be the young children who are visiting Anganwadi, or it could even be the providers, service providers in terms of municipal staff or Anganwadi staff, right? So can we come up with this kind of an objective, altogether, that whom do we want to, target as an audience, where we want to achieve some kind of positive behaviors. So any ideas whom we should put in case of an Anganwadi?
Anganwadi workers.
Right, Anganwadi workers.
Teachers,
Yes.
Yeah, Anganwadi
the teachers
worker.
counted there. We call them Anganwadi.
Okay, sure. Perfect. So we'll put our audience as Anganwadi workers. We have to next start thinking about, we want Anganwadi workers, that is our audience, to do what? This what will be a desired behavior that we want to achieve, right? Like we want them to do something which is a positive change in the space, or the behavior that also sort of enables a ITC centric environment, right? So any particular behavior we want to have?
तीस तारीख को मैंने बुलाया ना आपको, पहले भी मैंने 30 तारीख बोला था ना, 30 तारीख को मिले, ठीक है? वो ठीक है, मैं 30
Prakash,
तारीख
you
को
are
मिलूं, ठीक है?
unmuted. If you could just mute yourself. Yeah. Anybody from the participants, if they have any ideas of what we want the Anganwadi workers to do, which is basically having a positive behavior towards young children. We can list down multiple options here if we want.
In this, one thing that we can do is the Anganwadi worker to promote the playful activities, external playful activities for young kids of the Anganwadi centers.
Yes. Okay, yes, that's a good one. So that really focuses on promoting these external playful activities for young children of Anganwadi. Yes, that's a good one. Do we agree on that, or do we have more ideas if anybody else has any more suggestions?
We can add the word safe, like we want Anganwadi workers to promote safe external playful activities for young children.
Right. By external, do we mean outdoor, right? So maybe we can say to promote safe outdoor playful activities.
Yes.
Perfect. I think safety is important when we are, around these kind of ECD facilities, because in most of our cases, most of our projects, this has become like a very important lens to start with designing, right? That where do we have the scope for improving safety, because it is a major issue. So yes, I think that's important. Any more ideas?
Another important part of this playful activities is that in typical Indian cities, the Anganwadi center actually restricted to only one room. So what they are doing, that all type of outdoor playful activity, they are just showcasing those things to their kids inside that room. So it is actually the behavior change will be that if they start using the external space somehow, like taking their kids to the nearby park or nearby area, open space, and make sure that the young kids are engaged and playing in that will be one important behavior change.
I so agree with you, sir, because we always talk about these kind of outdoor learning environments, which are very positive for the nurturing of young children. And that's something that really lacks in our Indian context, I guess. So definitely this would be a very positive behavior. Yes. All right. So maybe we can move on to the next question, which is in reference to the same one. If we want Anganwadi workers to promote these safe outdoor playful activities for young children, then in this kind of a situation, to achieve this, what are the key barriers to the desired behavior? We have to list down 5 behavioral barriers. Barriers can be, it has to be something that is more than infrastructure really. Maybe there is some kind of problem in the system, some kind of problems that you think with the staff, the staff is not functioning that way. So any kind of issues that you think that are currently stopping this behavior. Any ideas?
Responsible government staff.
Okay. So do you mean here by government staff, do you still mean the Anganwadi staff, or do you think the
Anganwadi staff?
Okay.
Anganwadi staff.
Okay, so yes, I think having the sense of responsibility within the staff is the first and foremost thing, yes.
Second point can be the lack of understanding of the importance of outdoor playful activities.
Right, yes.
On early childhood development.
Right. I think that's also important because we know that sometimes there's a willingness to do this, but sometimes the awareness or the lack of understanding creates an issue. So if we are able to provide that kind of awareness, information to the staff, they might as well actually do it. So yes. Any more ideas?
Lack of space also. Nowadays we are seeing in Anganwadi, it's like a block or any primary school, they are taking one room and saying that but they are not giving the importance to the space for Anganwadi.
Okay. So space as a resource, you mean, right? Like you need more resources in terms of the space to actually enable these activities, right?
Okay.
Right. Any more? Yeah, that is true. Yeah, sometimes it just is stuck there to not have enough funding for these kind of behavioral spaces. Yeah, that's right. Any other key barriers that could be more behavioral also in a way?
Skilled employee.
Sorry?
Sometimes employee are not that much skilled. Even
by scale, do you mean what, sir, exactly?
We can say that if they have all the infrastructure facilities, but the employee or we can say the Anganwadi worker don't have that kind of skill to do all these kind of things.
Right. Okay, right. So lack of skill or expertise is something that we could provide them. Yes, yeah. Right. Maybe another one last barrier that we can think of.
In fact, we can think from the caregiver perspective also. The parents who are sending their kids to the Anganwadi center, their understanding,
awareness of.
Yeah.
Yes. I think that's a very important perspective, even to think of awareness of the caregivers, because ultimately they are sending their kids to this Anganwadi. So they need to
as well as parents also, awareness for the parents also, how Anganwadi should be there.
Yes, yes, that's right. So caregivers could be anyone in terms of, they could be parents, sometimes they are grandparents, sometimes they could also be elder siblings who are taking them to, Anganwadi and everything. So yes. Right. I think we've got the key barriers quite well. Now we can move to the next part. After looking at these key barriers to the desired behavior, we ultimately want to achieve this kind of a behavior, right? That we want these workers to promote these kind of outdoor activities for young children. So now let's say we've done some kind of efforts. We've put in some kind of interventions. So how can we measure that our interventions have made a behavior change? Right. So there are these few indicators that we can form. We saw a few examples of that footpath Uttara was mentioning, that in order to change the behavior, in order to make the people use the footpath, we did something, but we had to measure it to understand whether it happened or not. So can we think of some indicators, like in terms of quantity? How much did we do? What kind of things can we measure to understand how much did we do? And also this has to be, in terms of, it has to be more quantitative so we can measure it.
Number of messages on the importance of outdoor play activities.
Right. Yes, that could be one intervention that we will do, that we will want to sort of give them a message of the importance, because I think in the key barriers, we spoke about this importance, awareness as the main key barrier, right? So definitely.
Number of capacity building workshops for Anganwadi workers on the linkage between early childhood development and playful outdoor activities.
Yeah. I think that's a very important one. If you just tell them directly, if you show them through these workshops that how it is very much linked, and how it also serves the purpose that they want to serve by, having an Anganwadi. So definitely when your goals align, you are more dedicated towards it. Yes. So, right. We can think of maybe one more, which is something to do with, this capacity building workshops can also be trainings. It can be in different forms, And number of messages is this kind of outreach that we are talking about. So we've covered training, we've covered outreach. Can we think of something more that, how much did we do? Can we measure?
We can also see that with the messages, what is the percentage of Anganwadi worker we are reaching through this messages and the capacity building. So maybe the percentage of Anganwadi workers outreached with capacity building / training workshops.
Yeah.
Because that can be measurable. So it is a quantity, how much we achieved. Yeah.
Yeah, I think this is a very direct indicator also, that we can just see how many people we reached out to by having these kind of events. Right.
Yeah.
So I guess, in terms of how much did we do, we can definitely measure these very easily. Now the question is, we do these kind of interventions, but we don't know whether they have worked well, right? So we also need to have some indicators to tell us how well did we do it. So of course, we sent out messages, we had a capacity building workshop, we also checked, we also reached, we also had 50 people incorporated in these workshops. But did they have an impact? How well did we do it, So I'm wondering whether messages can also be checked to understand some kind of quality of it. So any ideas?
We can recall the thing from the Anganwadi worker. We can say the percentage of Anganwadi worker who can recall the message.
Yeah. Right. This is similar to what Uttara also gave as an example, that once you tell them the importance of this, it's also important to go to them and understand whether, they have understood it or they remember it. So we really know that it made an impact. Any more?
In fact, for the quality, the corresponding to the quantity one, the second one, the same thing that we can apply is the percentage of Anganwadi worker.
Yeah.
Who able to mention the linkage between ECD and outdoor activities. Because if we have done the capacity building and based on that, if 70-80% Anganwadi worker can mention the linkage, then that means there is a impact due to the capacity building.
Yes, I guess that's also important. Yes. Similar to the previous one, but it is slightly different because One thing is to also sort of to know what it was, but then the other thing is to sort of remember or explain. We'll be able to explain to others, right?
Yeah.
Yes. Okay. Anything else? Maybe we mentioned about these messages on importance of outdoor activities. So anyone else, like maybe since we're talking about Surat as a case example here, do you think anyone from Surat that maybe we can have some kind of check on if these messages are on social media, then how can we see if people reacted to it or people shared it across? So these kind of interactions on social media is also another way to check it, right? So any ideas on that?
We can say like, yeah, number of times.
Yeah. The messages on social media were shared or, received reactions. Yeah. Any kind of reaction. Sometimes, there is an event, so people say, I'm interested, or there is an event, people share it across to other people. So I guess that's become a very mainstream media also in a way nowadays. Right. Okay. I think this is good actually. Let's now move on to the effect part of it. Here, what we're trying to do is we've had some kind of efforts. We have measured the effort, and we've also measured how well that effort was. Now let's see what was the impact. So the idea, the final goal is that we want the staff to promote these outdoor activities in Surat's Anganwadi, right? So imagine if Surat's Anganwadi staff had to do this. What then after doing all these activities, after doing these workshops or the messages or any kind of trainings with them, what should be the impact? How can we measure the impact basically? So any ideas how we can measure the impact? Can we measure something that will tell us it made a positive change? Okay, yes, number of children playing outdoors. So maybe that starts to look like a positive behavior, right? Yes.
Probably also if in children.
Sorry?
Increase in the number of enrollment children.
Okay, yes, that can be also a little long-term indicator because it's possible that since Anganwadi now has these outdoor places, more and more number of children will start enrolling, right? Yes.
Yeah. Also, if like Anganwadis also start having a dedicated space for children to like comes more than just one room.
Okay, so okay, so you mean like the other Anganwadis start taking the model, huh?
Yeah, like for example, if new Anganwadis are getting built or something, then they make sure that there's a place for children to play, so and it's not just a one room.
Right. That is also important. That's a very direct indicator because if we want the Anganwadi staff to promote these outdoor activities, that means there'll be that advocacy factor that they'll tell the other Anganwadi people that, oh, you know what, we've created this open space outside our Anganwadi and now so many children have started coming to our Anganwadi and it's functioning really well. So maybe the other Anganwadis will also start doing this. So it's a little indirect indicator, but yes.
Yeah.
Right.
And the another point here is that actually the practicing piece, because we are talking about capacity building, we are talking about messages. So finally, what is the percentage of Anganwadi worker start playing with the young kids in the outdoor spaces? That will be one impact.
Yes, that's actually should be the first indicator that we should measure, right? Yeah.
Yeah.
Because this is a very direct behavior, and this is something that we want them to do as a first and foremost thing. And then in parallel to that, we want them to have like this enrollment, increased kind of goals, other Anganwadis adopting the same model, all of these. Yes. Right. So I guess this is good. If we can also think of some kind of other long-term impact indicators, like maybe if Surat has another Anganwadis, or like Surat has a committee that takes care of all the Anganwadis, then they start taking other workshops within their own staff. Maybe the supervisors of Anganwadi, they hold another workshop, which is where they start telling the other Anganwadi staff about this importance of ECD and outdoor learning. So that becomes an advocacy part again. When you tell someone about importance of something, and they tell third person about it, and that's how the message gets forward. All right. I would like to ask if any of the other cities also have an Anganwadi as one of the projects and are working there. If Hyderabad, Tirupur, any of these smart cities or other cities also have, then could you also think of something, something as a behavior that you want to achieve? Do we have like maybe I can see Harini ma'am there from Coimbatore, and ma'am, do you also have another ECD facility as a project where we can think of these kind of behavioral objectives?
In Coimbatore, we don't have Anganwadi project actually. Okay, only we have park.
Okay. So if we had a park, what kind of behavioral object would you like to propose? What would you like to see as a positive behavior?
If we take park, we want to encourage 0 to 5 to play outdoor, actually, because 0 to 5 don't intend to be there outdoor. We want to encourage.
Okay, so who would be the audience? Like, are you thinking of young children directly spending time, or would you want the staff to be enabling these kind of
young children and their caregivers, definitely.
Okay. So the audience would be the ITC, right?
Yes.
Okay. So I'll just try to make like a behavioral objective for your city, that we want 0 to 5-year-old children and their caregivers to spend more time. Yeah. Am I right, ma'am?
Yes.
Okay, that's great. So I'll just like to look at this also one example, that if we want these children and caregivers to spend more time, we should also think of what kind of barriers they are facing. Is it the park timing? Is it the access to the park? Or is it because they feel unsafe or something like that, so we can think of those. I think we don't have, just in the interest of time, I don't think we would be able to take up this entirely. But if you could also think of some issues that you think are the key barriers.
First thing is 0 to 5, the play elements are not there. Like there is no provision for those people.
Okay.
So safety might be the first thing is safety.
Okay, so safety perception could be an issue. Okay. Anything else that is also behavioral, like why do people not come, or why do people not spend time there?
People are so much worried about their immunity. So cleanliness, we can say.
Okay, yes. cleanliness and hygiene of the space really affects the behavior. Yeah. Right.
Yes.
Yeah, these I think in Indian context make a lot of sense and we see them quite often. Right. Right, that's a good one. Yes, I think we see that in many of our projects where these vulnerable sections feel that they're not part of it somehow, of such projects. Yeah. Great. And if you wanted to have a very direct, also another thing is, I think we are closing the session, but I would like to just add when we are thinking of these key barriers, we have to also ensure that they somehow relate directly to our designs in a way that our designs start talking that this is a behavior that I want to achieve. Simple as maybe the footpath should be where they generally walk, or the entries have to be very well lit so that they feel safe to answer to your safety perception, or to answer to your inclusivity aspect also. We have to ensure that somehow it's free of tickets or things like that. So there's no social or economical barrier at all. So directly or indirectly, we will have some positive behaviors. All right. I think we've all had a very fruitful session. I will share this sheet with everyone of all the cities, and we urge all the cities to also create a sheet of their own, which becomes part of the proposal. So,
thank you all. Bye.
All right. Thank you so much. We'll see you back in the
So yeah, thank you all for conducting these groups and for participating. I know it was probably a lot of new concepts for some of you, but I hope that the exercise helped you to start thinking about how to go about defining these types of objectives so that you can take this forward. So before we close for today's session, we wanted to also just wrap up by talking about the way forward. So for that, I would ask my colleague at WR India, Sri Kumar, to share these points with the cities.
Sure. Nandini, you will share the slides?
Sure.
Thanks to all the cities for joining. It has been a great 5 workshops in a month, and it's been a lot of working together and listening to each other, and it has helped us also learn a lot. And I hope you find this useful and in terms of helping in implementing the projects. And we would like to just kind of just talk a little bit through what we are planning to do till the end of the cohort stage. And mostly these things you already know. We just want to kind of remind and kind of place it in this reference and where we are in the timeline. We can go next slide. Okay, so we are past the mid of the cohort stage phase, and many cities have already done the data collection, and a few of the cities are still doing it. So hope we complete it soon, and also look at an analysis of the neighborhoods where we are doing the projects. And looking at also through a mapping point of view, just to see how the projects are coming together, how they are complementing each other, how they are integrated, how they are more integrated solutions, and give a more visible, a very visible and more useful improvement in the neighborhoods. So that's one, and then many cities have already conducted workshops connecting with the stakeholders and conducting focus group discussions, and we hope that we continue to do this, continue to have this conversation with the stakeholders, and also all the cities try and do this. And then as other is finalizing the design proposals. A few of the cities have kind of completed the design proposals for all the pilot projects, but many cities are still on the process. We need to quickly get on to completing that. And then identifying tactical interventions. I think last workshop we did quite some discussion on the tactical interventions, and probably cities are already working in identifying them. And here I would like to just want to remind again the importance of identifying semi-permanent solutions, semi-permanent components as a part of the tactical. So that itself continues to keep the momentum on and the interest in doing these kind of solutions in the cities. Then implementing the pilot projects, identifying funding and getting the work order and so on in the cities to get it implemented, and then communicating in the public domain. I think today a lot was discussed around this, and hope that this point has been cleared again, and we expect that a lot more hearing from the cities what they're doing, and with the people through the discussions, using the opportunity to discuss with the people, and also in the larger domain of urban development in the country, how this is making a big difference. Then another is the scaling up plan. So we are still now, until now we've been working in the neighborhoods, one neighborhood. Now, how do we go ahead to scale this up, these efforts across the city? Some ideas on that. And then, and of course, then preparing for the final pitch for the jury, and documenting all the projects implemented. Next slide. So the timeline, I think it's we all know, already heard about this. Probably I will just ensure, just to give an idea. Here, the Peer City workshop is planned for the August, where all the cities will have opportunity to present what we're doing. And then we, as you know, by September 15th, we will try and implement all the solutions in all the cities as a deadline to implement. And then we will, in October, we will plan to have the documenting the implementation and preparing the final pitch for the jury. Next. So just to help, as we all know, we have WR India team is available with you to support you in all the processes in preparing these. So just to remind on few things which we will share with you, please look out for these. One is the evaluation criteria for the cohort stage. This is to give you some idea of how the cities, how the 25 cities are competing with each other, and what are the criteria will be used to evaluate. That's one. And then the second is how we are going to document the implemented proposals and also all the solutions, pilot proposals, and scaling up template. That also we will send you on how to prepare this scaling up plan. And then the final pitch. Final pitch is something which will be presented to the jury. So whether it will be also in the form of a presentation, and also cities can also prepare a video to make it clearly communicated. So these are the things. Looking forward for working more with you, everyone. And thanks a lot for joining again. And thanks to the ministry team for all the coordination. Thanks to BVLF, and especially today's speakers, Uttara, Sam, Sanjita, and team. Thanks a lot.
Thank you. So Before I just hand over to Rushta to close the session, I wanted to just request if everyone, since this is our last workshop in the series, if everyone could actually just briefly turn on your videos so that we can just capture this. Since we were not able to meet in person, we can do like an online photo. So I just skip a few seconds for people to turn their videos on. And let me just okay. I am not able to get everybody on the same screen, so I'm just waiting for a second for that to happen. Just okay. Just give me 1 second. Smile, everyone. Thank you. Thanks very much. So with that, I will actually, we are just a little bit over time. Thank you all for staying with us. But I wanted to request Rushta Majid, the India representative for the Bernard Banlia Foundation, if she could close the session for us and share some words for the cities.
Thank you so much, Nandini. So first of all, I will like to echo what Shri just said. Thank you very much to the Ministry of Housing and Urban Affairs and to the Smart Cities Mission. Of course, to the Deputy Director, Pooja Sharma, for chairing the session today, and to the Mission Director, Kunal Kumar, and Director Rahul Kapoor, who have been providing us support and guidance throughout. Of course, thank you to the WRI team, the DAMU team that has helped coordinate, and last but not least, to all the cities and agencies that have joined all our sessions as part of the 5 technical workshops and all the Nurturing Neighborhood Challenge cities. So all the cities by now have participated in 5 sessions. We started with how to count young children and their caregivers, and some of the experts talked about how they understand their needs in the public realm. We also saw some sessions talk about innovative ways of data collection and how that can link to designing pilot projects. We also talked about purely the design of pilot projects from the lens of 0 to 5-year-old children and their mothers or fathers or their siblings or grandparents. We also talked about temporary interventions and how they are useful in terms of learning what works and what doesn't work on the ground. And we also heard from some of our cities, including Pune. And finally, today, we heard about the importance of behavior change and how that can contribute once we incorporate into our thinking into the urban planning and management lens, how that can influence healthy child development. So in particular, I'd just like to point out that today's session was critical in terms of highlighting this importance of behavior and how it applies to your own work. A lot of people from the cities are here, a lot of people that are working with cities. So we hope that it was useful for you to think about behaviors from this framework of what Sam pointed out, 1 + 1 + 1, and why we need to think about behaviors of not only our target audience, in this case, the caregivers and also the young children, but also service providers, the municipal staff that is day in and day out dealing with young children or catering to the needs of young children and their families in cities. And of course, we also talked about why it is important to monitor and to measure, because this is going to influence how you think about users and also the most effective interventions. So once again, we hope that these sessions were useful to you as you test your solutions on the ground, as you build stakeholder supports, and of course, as you further refine your proposals for final submission. And we hope that the challenge continues to be an exciting journey for all of you that allows you to think from the lens of very young children, this height of 95 centimeters, the height of a healthy 3-year-old child. And of course, I just want to end by saying that as you continue to apply and think about how your cities can continue to engage with young children and their families, how they can continue to apply this lens will not only support the demographic that we are talking about, but it will also benefit the quality of life of all residents, because as we know, cities that work for very young children tend to work for all. So with that, thank you once again, and looking forward to your continued participation in all the upcoming workshops and activities, and looking forward to the final application. So thank you very much, and over to you, Ananda.
Thank you. Thanks, Rishta. Thanks, everyone. And I will just also say that if you have any feedback on the workshops, and also, for future workshops, if they're, in the next stage or in the future, if there's any specific topics, for instance, that you think it would be helpful to kind of focus on in terms of capacity building, we welcome you to share those ideas with us. You can share them in the WhatsApp group or directly with the kind of WRI India coordinator who you're in touch with, or send us an email. But yes, thanks again for all of your participation. Thank you to the speakers, and we look forward to seeing the next the results of this stage. Have a good evening, everyone.